Okay, we'll go ahead and get started. Hi, everyone. Welcome. Thanks for joining us today. My name is Carrie, and I work on marketing here at Family Matters. Before we get started, I just want to take a minute to introduce our agency and talk a little bit about what we do. So we are a family-owned and operated in-home care agency serving clients in the Bay Area, San Diego, and Sacramento areas. We staff more than 300 caregivers who provide care for our clients in the comfort of their home or the facility where they live. And our team does their very best to make sure it's a good match between our caregivers and clients based on both the client's needs and personality. And they assist clients with daily activities like preparing meals, light cleaning, personal care, transportation, rehabilitation exercises, and also provide companionship. Our caregivers also receive ongoing training in dementia and Alzheimer's care and are prepared to work with clients experiencing cognitive decline. After the presentation today, we will send out additional information about our services if you have any questions. We will also send out, following the presentation, probably in the next day or two, a recording of the webinar, should you want to revisit any of the information Tami presents. And last housekeeping item before we get going, if you have any questions or comments during the presentation, go ahead and put them in the chat or type them into the Q&A. Which should be at the bottom of your screen, maybe the top if you're on a mobile device. And we will make sure to have time at the end for Tami to go over them. I think that's all I have. So I will turn things over to our presenter today, Tami Anastasia. I'll let you introduce yourself.
Okay, thank you, Carrie. Hello, everybody. Thank you for attending today's webinar. As Carrie mentioned, my name is Tami Anastasia. I am a dementia consultant, educator, and the author of Essential Strategies for the Dementia Caregiver. I have a private practice and I provide counseling services, dementia guidance, emotional support, and care strategies to family and professional caregivers. I also facilitate twice monthly caregiver support groups. So today I am going to talk about the warning signs of dementia. Many people are worried that they may have signs of dementia. So I wanted to kind of help sort out what's the difference between normal aging and signs of dementia. So I'm going to begin my presentation by clarifying a few things. The first thing I want to clarify is, what is dementia? Dementia and Alzheimer's tend to get used interchangeably. So I just want to distinguish what the difference is between dementia and Alzheimer's. So dementia is a general term that we use to describe people with cognitive impairment that interferes with daily living. So there's over 100 different types of dementia. So think of dementia as the category. That's the category we use when people have a diagnosis of any type of cognitive impairment that interferes with daily living. So we have cancer. Cancer is a category, and there's tons and tons of different types of cancer, but cancer has its own category. Dementia has its own category, and anybody who has any type of cognitive impairment, and the key is it has to interfere with daily living for it to be a dementia, then dementia is the category. All dementias are, unfortunately, there's no cure right now, and they're progressive. And the rate of progression varies from person to person. The most common type of dementia, though, is Alzheimer's. So Alzheimer's itself is a type of dementia, is the disease, and then now dementia is the category. So it's just a nice way to clarify, what's the difference between dementia and what's the difference between Alzheimer's in terms of using the terms. The second thing I want to clarify is, does dementia only affect memory? Many people will come up to me and say, oh, I don't think my loved one has dementia because they don't have memory loss. Well, dementia affects more than just memory. Dementia can affect reasoning, thinking, processing information, problem solving. It can impair their judgment. It can affect mobility and the executive functioning, as well as visual spatial perception. So by the time someone has a diagnosis of dementia and it has progressed, it has affected every single cognitive function. So at the beginning, you may only see impairment in certain things, but over the course of time, you're going to find that it's going to impair, again, every cognitive function. Then the third thing I want to clarify, do people with dementia have control over the things they say and do? I work with a lot of private clients, and one of the things I hear frequently is my loved one just says things that are embarrassing and insulting. And what you need to know is, as dementia progresses, people lose the ability to censor or filter the things they say and do. So they lose the ability to control what they say. So they may say things that are embarrassing. They may say things that are hurtful. They may say things that are inappropriate, and know that they don't have control over that. And the other thing I want to point out that goes hand in hand with this is people with dementia do not lie intentionally to deceive you. People with dementia confabulate. Their brain is malfunctioning now. And so what happens is that their brain starts to distort information. So what's going to happen is they're going to tell you things that aren't true. They're going to tell you things that are inaccurate. They're going to tell you things that are incorrect, but they are not in control of that. This is something that is a symptom of dementia. So it's important that you reframe what you say to yourself about your loved one or the person you're taking care of that has dementia, because that's going to affect how you react. So know that people with dementia do not have control over the things they say and do, and they do not lie, but they do confabulate. Their brain gets data confused and it cross-references, but know that their distorting information is something they have absolutely no control of. The fourth thing I want to clarify is that, do people with dementia, are they aware of their limitations? So many people will be really frustrated because they think their loved one with dementia is in denial. Well, what you need to know is 60 to 80% of people with dementia are not aware of their limitations, not because they're in denial, but because there's damage done to the frontal part of the brain and to the temporal part of the brain, which is behind the ear. So if there is damage done in the frontal or temporal part of the brain, that is where self-awareness is stored. So if there's damage there, there's nothing in the world you can say or do to get them to see their limitations. So I have visual impairment. I'll use myself as an example. You can tell me whatever you want to tell me. Can you see this? Can you see that? And if I say no to you, well, they'll try to point out to me, oh, you don't see it? It's over there. I can't see what I can't see because of my visual impairment. And people with dementia can't see what they brain damage that's being done as a result of dementia. And there's a medical term called anosognosia. It's spelled ANOSOGNOSIA. It's a medical term for people when there's damage done in that part of the brain. They have what is called anosognosia, and they're not able to be aware of their limitations. So really good and important information to have. So next, I'm going to talk about what are signs of normal aging. And hopefully a lot of you will get peace of mind to realize that some of the things you're probably saying and doing are part of normal aging. So entering a room, forgetting why and remembering later is part of normal aging. And a lot of times we may have, we're going to go get something, but for example, myself, I want to go in the other room and get something. The phone rang. I picked up the phone. I'm done with my phone call and I'm now going to the other room thinking, oh my gosh, what did I want to go there and get? Or if I'm distracted, I might forget what it is that I want to go get. But what will happen is that I will remember later what it is that I wanted. And that's the key, is I can remember what it is I wanted to get later. It is also very normal for us to miss a monthly payment and not realize it. So I'm going to use myself as an example again. I am a very paper person. I have always been dependent on paying on my bills when I receive a bill in the mail. Well, a lot of bills are not coming in the mail now, and they're online. So I have to adjust and come up with a different system to remind myself that this monthly payment is due, and I have to come up with a system to check my emails, or I write down when I should expect the payment, and I have a list of all my monthly payments, because now I can't depend on the bill coming in the mail. So again, the key here though is that I'll realize that I missed a month. I recently just missed a month paying a bill because I didn't get it in the mail. So what's important to realize is that as long as you become aware or you realize that you didn't pay a bill, that's signs of normal aging. Saying the wrong day and correcting yourself, that's super, super normal as well. Let's take COVID, for example. At some point, we were so locked in our homes, all the days seem to blend. When there's a holiday, for example, we just had 4th of July. I have to constantly remind myself that on that holiday day, it's not a Saturday, it's not a Sunday. But here again, you're going to correct yourself. There's times where you might say, oh, today's Saturday. Oh, wait a minute. No, it's Sunday. You're going to realize, you're going to correct yourself. So it's a sign of normal aging if you should happen to say the wrong day and then you correct yourself. It also is a sign of normal aging when you can't think of the right word. That happens to me a lot. Like I'm talking, I have a conversation, I want to use this word and it's not coming to me. And then I always joke and say, well, at 3 o'clock in the morning, I'll call you and tell you what the word is. Point being is eventually I'll think of the correct word. But, you know, when I'm in a conversation and I'm trying to think, oh, what's that word? I do a lot of Q&As. And when I'm asked a question on the spot, I'm trying to think, what's the word I want to say? Sometimes I can't think of it in that moment, and then I'll think of it later. It's also normal to be absent-minded, distracted, and preoccupied. I really think the older we get, it seems like we're more preoccupied, we're more distracted, and we're more absent-minded. It just seems to be, as we get older, there's just more and more things on our plate. So it's normal to be absent-minded. It's normal to be distracted and preoccupied. There's a lot of things going on. It also will take longer for us to complete tasks. We slow down physically and our brains slow down also. So expect that taking longer to complete a task is total normal. It's normal for us to be slower at getting things done, and it's slower for us to do things. That's normal aging. It's also normal to be able to retrace your steps. That's key, that you can retrace your steps, going back to getting something in the room. I can retrace my steps. Sometimes I have to walk back into my office and then think to myself, okay, what was I going out to the kitchen for? What was I going out to the other room for? And that will jar my memory. Oh yeah, I wanted to get such and such. It's also normal to be able to recall and retrieve information. That's all normal. We want to be able to recall, we want to be able to retrieve information, and it's normal to recognize familiar people, places, and things. So these are all signs of normal aging, what we can expect as we get older. So next, I'm going to talk about what are signs, though, of dementia, warning signs of dementia. So one of the warning signs of dementia is that they will be experiencing memory loss or increased confusion. And it's more than getting confused about the day. It's more than it's severe confusion. They'll often confuse the past with the present. Something that happened 30 years ago, they may think happened today or yesterday, or they're concerned about something that happened 30 years ago as though it happened today. Increased confusion, they'll be very disoriented. So we're not talking about being simply confused by thinking, oh, today's Saturday and tomorrow's Sunday. No, this is severe confusion. Also, getting lost going to or from a familiar place. I have a friend who is a brilliant, brilliant surgeon. And she called me probably about a year ago and said to me, Tammy, I'm lost. I can't figure out how to get home. And she was about a mile away from her home. So I said, oh my God, totally a red flag, something that they're able to go, they've come and gone, and she's worked at this hospital for 30, 40 years, and then all of a sudden couldn't find her way home. So getting lost going to or from a familiar place, someplace that they drive frequently, they go to frequently, all of a sudden they're getting lost. Or like going to the grocery store, all of a sudden your loved one is like, where are they? They should have been back by now. And if they got lost, this is a warning sign. Another warning sign is increased clutter, such as unopened bills, delinquent notices, and magazines. Now, some of us are more organized than others. So increased clutter, we're not talking about a few bills spread out. We are talking about stacks of bills, stacks of magazines. And what's really alarming is that there's probably delinquent notices because they've forgotten to pay their bills and they're not opening, or if they are opening the mail, they're not able to understand that they're receiving a delinquent notice. So that is a warning flag. Now, for someone who's not so clean, you're going to find this is going to be above and beyond their baseline. Someone who's probably a little disorganized, things are going to look a little bit out of sorts, but it's going to become clearly obvious things are stacking up. Those are warning signs. And then repeating the same questions over and over. So I'll use myself as an example again. I will repeat myself over and over when I'm trying to prove a point. When not to prove a point, but when I'm trying to drill in a point, or I'm really trying to make a point. They say, well, you got to repeat things 2-3 times for people to get it. But this is different. Repeating the same questions over and over, I have no clue that I've been asking you the same questions over and over. And you know why that is? Because I can't remember asking you the question, and or I don't remember you answering the question. So repeating the same questions over and over are huge signs of short-term memory loss. And then also having difficulty scheduling and keeping track of appointments. So I've had a couple clients where their loved one was an event planner. They were meticulous. They were so organized, and now they couldn't keep track of any appointments whatsoever. So they'll have difficulty scheduling appointments, keeping track of appointments, showing up at the right time. They may not show up at all. So we start seeing they're having difficulty keeping a schedule and following through with appointments. Then another warning sign is unexplained weight loss, empty refrigerator, or one full of expired food. So this is certainly something we look at when an older person is living alone and we're suspecting that they may have cognitive impairment. But what I do want to say is unexplained weight loss, no matter what, is a medical thing you always want to pursue and find out why are they all of a sudden losing weight. So even if they don't have cognitive impairment, unexplained weight loss is a good reason to go ahead and make a medical appointment, because we want to explore why is this person all of a sudden losing weight. So when I'm called to do assessments and the person lives alone, one of the things I do is I go straight to the refrigerator. I say, I'm thirsty, or could I get something to drink? And I check out the refrigerator. If there is no food in that refrigerator, or it is completely full of expired foods, that is a red flag that we're dealing with probably some cognitive impairment. Then another red flag is being unable to follow directions, such as a familiar recipe. So a lot of my clients have loved ones that have cooked, excellent cooks, cooked their whole life, loved cooking. All of a sudden they can't follow a recipe that they have cooked for many years, or they're getting very confused, or they're putting the wrong items into the recipe, what they're making. I see that a lot too with people who've been in construction or a handyman, been able to follow instructions, put things together, no problem, all of a sudden can't do it. They're nailing or screwing in parts where they don't belong. So these are warning signs. Also, personal hygiene, that's another red flag. Wearing dirty clothes, having body odor, or not showering. And you're going to notice they're just unkept. And the problem is they're not even aware of it. And for someone who's always been well-groomed and always, again, meticulous in how they dressed and their appearance, and all of a sudden they're letting themselves go, that's going to be a red flag. And we have people, you know, who just are very casual in dressing. You're still going to notice there's a decline in their personal hygiene, their hair, again, the odor, the clothes, they're wearing the same clothes for 3 or 4 days, or there's a stain and they're not washing the clothes. So another warning sign. Also having problems with words, language, reading, writing, or speaking. Everybody's familiar with Bruce Willis. This was classic symptom for him. You'll find that they'll have difficulty with language. They'll have difficulty with words. They're not able to read probably what the written word, what's happening. You'll find their writing will start to change. In some cases, what I have observed with my dementia clients is that I'll look at their handwriting pre-dementia, and then I'll look at compare the handwriting to when they get dementia, and we'll notice, or at least I have in my practice, that the handwriting is often either smaller or it's just different. So this is another red flag. Demonstrating impaired judgment or difficulty completing a task. So I have a daughter, and she was concerned about her father. Her mother was moved to a care community, and all of a sudden her father, to me, started to show signs of cognitive impairment. So anyway, she was like, no, I think my father can still live, you know, by himself, but, you know, I do have some concerns. Well, father got scammed and wrote a check for $50,000. And it just so happened the day that he did that, she gets together with her father and they go through the checkbook. She saw this check written for $50,000 and went straight to the post office. You're not going to believe this story. Got there just before the post office closed. They went through the mail, if you can believe it, and they found the envelope. So impaired judgment, this is why they get scammed very easily, because their judgment is impaired. My father had diabetes for many, many, many years. And I would say the last year of his life, he was making these weird decisions that were just so out of character for him. Back then, I didn't know what I know now. And he didn't have dementia, but he had diabetes. And there was a lack of oxygen getting to his brain. And he was making these bizarre decisions that were very out of characteristic for him. So that will be a warning sign of dementia or cognitive impairment. Incorrectly taking their medication or forgetting to take medication altogether. That's a huge warning sign. All of a sudden, they don't know why they're taking it, or they're very confused about what they have to take, or they argue with you. Why am I taking this? I don't need to take it. I don't have to take it. I'm not supposed to take it. These are all going to be warning signs when it becomes a battle with their medication, or again, they absolutely forget that they need to take medication is going to be a warning sign. And then also misplacing items and accusing you of hiding them or stealing them. That's a classic. And the reason that happens is they don't remember having the item. So let me put it to you this way. The other day I cleaned my office. And I remember I had this piece of paper. You know, sometimes organizing my office makes things worse for me sometimes. And I'm like, oh my God, I remember having the paper in my hand. I just can't remember where did I file it. But what I recall is I'm the last one who had that piece of paper. Well, imagine if all of a sudden I don't remember having that piece of paper. And then somebody was living with me, or the house cleaners came in. The brain's default is if I didn't move it, if I didn't touch it, if I didn't handle it, someone else must have moved it. So because of their short-term memory loss, they don't remember having the item. They don't remember they're the ones that moved it. The brain's default is to blame you for misplaced items. They're going to blame you for stealing that item because they don't recall they're the ones that move it. So what I'm going to advise all of you, if any of your loved ones are moving items, see if you can figure out what their hiding places are, and you want to buy duplicates of the items that they're hiding. They're usually going to be a purse, a wallet, a remote control, glasses. Those are the main things, and jewelry. that will go hiding and missing. So these are just a couple warning signs. What I want to say about the warning signs is this. Often you're going to see more than just one warning sign. You're going to see that they exhibit a few of these different warning signs. And also the warning signs have to be out of character for the person. They're out of character. They're just out of sorts. There's something off. Trust if they're out of sorts. Trust that if they're off, we want to explore and look more into what might be going on. So the four most common types of dementia that we hear about is Alzheimer's, and Alzheimer's character signature is memory loss. That's usually very indicative that they have Alzheimer's. And again, it's the most common type of dementia. The second most common type is vascular dementia. So vascular dementia is something we see when the blood flow is either constricted or interrupted or narrowing of the arteries, and they can't get oxygen to the brain as well as if the blood was flowing better. This can occur because of narrowing of the arteries, diabetes. It can occur because of a stroke. It can occur because of a TIA, what we call TIA, mini strokes, MINI, but it has to do with the blood flow. And this is what is called vascular dementia. And the signature hallmark on that one is that you'll see they're having difficulty with thinking, problem solving. I have a client that I've been working with for many years on other counseling issues. So I've known her for years, and I've known her family for years, and she started telling me some things her mother was doing. I said, you know, I'm just going to tell you right now, your mother sounds to me, she's showing signs of dementia. Very good with numbers, excellent with numbers, very anal about certain things. Well, all of a sudden her mother was not that way at all. And I said, you know, let's just observe. So mother has sleep apnea. They thought, well, maybe it's sleep apnea. Well, here's the hallmark. So my client has a little dog, and the mother loves the dog. When my client brought the dog to see her mother with her one day on a visit, the mother said, whose dog is that and what's the name of the dog? Mother's been diagnosed now with vascular dementia. Then we have Lewy body dementia. The signature hallmark for that is they'll have hallucinations. And also Lewy body dementia is in the Parkinson's family. It's something that we see that can go hand in hand with Parkinson's. Not everybody who has Parkinson's will get Lewy body dementia, but there's about 50% of people with Parkinson's who can get Parkinson's Lewy body dementia. And then frontal temporal dementia. This is again what Bruce Willis got diagnosed with. And we'll see behavior changes, personality changes are the hallmark, and they're going to have a lot of difficulty with speech, with language. And he has aphasia. So I knew when I heard that, I said, most likely he's got frontal temporal dementia. And Robin Williams, he actually was misdiagnosed, which happens a lot with Lewy body dementia. He was diagnosed as having Alzheimer's, but when he passed away, they donated his brain to science. When they did a brain autopsy, he ended up having Lewy body dementia. So these are just the four most common types, but remember what I said earlier, there's over 100 different types of dementia. So good information to have. So next, what are the hallmarks of dementia? Well, one is their symptoms are gradually going to get worse. That's one thing I can honestly tell you, that you'll start noticing things, they're not going to get better. They're going to increase over time. And this is why they are usually symptomatic about 3 to 5 years before they even get a diagnosis. When I ask clients, you know, did you notice symptoms before you got the diagnosis? They'll go back 3 to 5 years. And that's because it takes time for things to get worse. None of us want to believe that our loved ones have dementia. None of us want to believe worst case scenario. So it takes a little while because the symptoms gradually get worse over time. Also, they'll have behavior or personality changes. Let me go back to something I said earlier. A person who's you've never heard your loved one swear or use cuss words or profanity, and then all of a sudden they're just saying these things left and right. Again, because they can't censor or filter, but we'll see behavior or personality changes. In some cases, someone who's always been really temperamental and really hostile, some cases, it's a small percentage, they may become very mellow. In other cases, somebody who's always been very mellow, very even keel, can all of a sudden become very, very agitated, angry. So we'll see personality changes because of what's going on in the brain. The familiar is no longer familiar. They will not know what items are for or how to use them. So I'll give you an example. I have a client right now, and his wife goes out in the garden and she digs holes with a spatula because she thinks it's a shovel. So familiar is no longer familiar. One of my first clients, when I started my private practice, her husband put his shoe in the freezer. So when familiar is no longer familiar, that is going to be a hallmark of dementia. Also, they can't do what I call the 4 R's. They're not able to retrieve information. They're not able to retrace their steps. They're not able to remember. And they're not able to recognize, again, familiar people, places, or things. So the 4 R's they cannot do. And then their cognitive changes interfere with daily activities. That's what's key. To have a diagnosis of dementia, the cognitive changes have to interfere with a person's ability to live independently and to care for themselves and perform daily activities of living. So these are the hallmarks of dementia. So we have what is called 6 cognitive domains. Another thing you want to know is that there only has to be impairment in 1 out of the 6 cognitive domains in order to get a diagnosis of dementia. So what are those 6 cognitive domains? One is what we call complex attention. When there is impairment in complex attention, we're going to find they have difficulty focusing, difficulty concentrating. They're going to have difficulty absorbing or processing information. That's complex attention. When we find impairment in the learning and memory domain, this is where we're going to see they can't learn new information. This is where they're going to repeat things over and over again. They're not going to be able to remember things. They're not going to be able to recognize things. This is in the learning and memory domain. So if we see impairment in that area, this is where you'll see them repeating themselves over and over, and they can't do what I call the 4 R's. Language, that domain, when that part of the brain is compromised, language is here where we use words. They'll have difficulty. If there's impairment, they're going to have difficulty with word finding, or they're going to use words completely out of context, make no sense. Their thoughts may get interrupted. You'll find they'll be talking and then all of a sudden they're stuck. They can't get the word out. Their train of thought gets stuck. And this is language. You'll find that also they'll have difficulty understanding the written and verbal communication becomes very difficult. Executive functioning, that cognitive domain, that's what allows us to schedule. This is the executive functioning part of the brain. This is where planning, scheduling, organizing. When that domain is impaired, this is where they're going to have difficulty scheduling appointments, keeping track of appointments, following through with appointments. Organization will lack. And they're easily distracted, very easily distracted. So they might start on a task and they are easily distracted by a noise or something they saw outside. So when the executive functioning domain is impaired, this is when we're going to see problems in the executive functioning, scheduling, planning, organizing. Then the other 5th is perceptual motor control. This is what allows us to recognize things And so when this part of the brain, that part of that domain is impaired, this is where we can no longer recognize familiar people, places, or things. And also this part of the brain is often where their perception will get distorted. And with people with dementia, their field of vision gets very, very narrow as dementia progresses. And at some point, their field of vision is what they see is truly looking out of like binoculars. So when this part of the brain, that cognitive domain, is impaired, that's where we're going to find, I don't know if you've ever seen somebody, but there may be a slight crack in the sidewalk, and you see them lifting their leg up really high to go over it. So there's impairment probably in the perceptual motor cognitive domain. And then the sixth one is the social cognition. This is where they will become very apathetic. One of the symptoms of dementia, sadly, is that they become apathetic. They lose the ability to motivate themselves, to be a self-starter. They lose the ability to initiate and do things on their own because of the damage that's being done to their brain. So what happens in this domain also, this is where we'll see impaired judgment. If there is impairment in that part of the cognitive domain, we're going to see them say things that are inappropriate. This is where they're going to do things that don't make any sense. They'll blurt out. They'll not be able to censor or filter the things they say and do. And also what's really sad about this one too, is this is where they lack empathy. All of a sudden, their ability to empathize with others, they lose that ability. And I'll give you a current example. So a client of mine recently just lost her very, very, very best friend. And they've been best friends for 60 years. And she went to tell her husband, I am so sad that, I'll call her Betty, that Betty passed away. And the husband just had a blank stare, no reaction, because he doesn't have that ability to empathize anymore. So these are 6 cognitive domains. To get a diagnosis of dementia, there just needs to be impairment in one of these domains. Often, though, we'll see impairment in more than one domain. But I just wanted to kind of give you more information as to the different parts of the brain and what functions they provide. So what do you do if you suspect your loved one has dementia? My first recommendation is to start documenting your observations. In other words, really, truly keep a log, write down the date, write down the time, and write down what you're observing. Because, like I said earlier, if it is cognitive impairment / dementia, it's only going to get worse. So we want to track the frequency. How often is it occurring? Because again, it could start off really, really, really slow, but what's going to happen is that it's only going to get worse over time. It's going to increase over time. So if it's a one and done, that's one thing. But the way to really get a good sense as to what's happening is to start documenting your observations. And again, keep a log, write down the date, write down the time, write down your observations. So if you're suspecting or concerned about your loved one, and we go to the doctors love data. You have it in front of them. They can't dismiss your concerns. You have the data that says this is what's going on. So they can't just dismiss it from here and there. They can explore and look into, wow, what is going on that could be causing these behaviors. Then you also want to ask for a referral to a geriatrician, a neurologist, or a neuropsychologist. Your primary care doctor is not going to be the best person to work with once, or to figure out whether your loved one has cognitive impairment. So you definitely want to ask for a referral to either a geriatrician, neurologist, or a neuropsychologist. Sometimes they're called psychoneurologists as well. Then you're going to want to provide a detailed family history. I mean, detailed. Doctors are going to want to know anything and everything about your loved one's past, anything you know about his parents, his siblings, and maybe even a generation before that. Then you want to arrange, or it's really important that we get a battery of tests. We don't want a diagnosis just based on one test. It really get a true diagnosis involves doing a battery of tests. And those include doing a blood test, cognitive and neurological testing to assess their thinking and physical functioning. If somebody has Lewy body dementia, for example, and it's in the Parkinson's family, we're going to want to look at their movement. We're going to look at their motor skills. We're going to look at their gait, right? And we're going to assess their thinking. So you want to have cognitive and neurological testing. We just don't want to leave it up to one test. We want to have a few tests, different tests done to confirm and to make a definitive diagnosis. And then brain imaging, either an MRI, a CT scan, or a PET scan. And the reason we want to do this workup is we want to rule out other medical conditions that could be contributing to the personality or behavior changes, because there are medical conditions that can mimic dementia-like behaviors. Urinary tract infection, UTIs, notorious for mimicking dementia symptoms. Also, you want to rule out dehydration. That's also notorious for mimicking dementia symptoms. And also pain. If a loved one is in a lot of pain, we want to rule out that pain is contributing to the changes you're seeing. And we also want to rule out like a thyroid imbalance that can contribute to dementia-like symptoms. And then vitamin B12 deficiency, vision, hearing. There's things we want to rule out first. So when we make a diagnosis of dementia, or when a diagnosis of dementia is made, we've ruled out any medical conditions that could be contributing to it. So this is just to give you a nice overview of warning signs to look for, know what is more normal aging. And then if you do suspect, I've provided you with the steps to pursue in terms of if you suspect that your loved one could possibly be showing signs of dementia, the steps to follow through with so that we can get at the underlying issue that could be contributing to their situation. So in closing, I would like for all of us, I think all your mics are off, and I would like for all of us to read this quote out loud together. And so on 3, please read this quote with me out loud together. 1, 2, and 3. One person caring about another represents life's most significant value. I do want to thank each and every one of you for the love and the care and the support that you provide if any of you are caring for a person or a loved one living with dementia. Thank you for everything you do to provide the best care for them. So now I have left time for any questions. So if anybody has any questions, concerns, frustrations, please feel free to chime in and ask, and I will stop share screen so that we can do that.
Okay.
Okay, there we go.
We do have a question.
Okay.
This one came kind of earlier on, so it might have to do with one of the earlier slides. It asks, are dementia caused by TBI, and I'm sure I'm pronouncing this wrong, anoxia?
Oh, anosnosia.
Thank you.
Uh-huh.
And vascular non-progressive.
So I'm not a medical doctor. If somebody has, so traumatic brain injury is what TBI is.
Okay.
And then you have anosnosia. When there's damage done in that part of the brain, chances are it's progressively going to get worse. Yeah. Yeah. Now, depending on the trauma that's been done to the brain. So you always want to ask the medical doctor, because they've got the tests, they've got the brain images, they've got that information. But typically, if traumatic brain injury and they have a diagnosis of dementia and they have anosognosia, it will progressively get worse.
Okay.
Yeah, great question.
Somebody is asking if this information is in your book.
Yes.
Okay, great.
The cognitive domains, I did not break down. They're not in my book, but I talk about all the brain changes from a behavior standpoint, personality standpoint, and cognition. So it's all in there. I just didn't write down the 6 cognitive domains that way.
Also, just to note, if you did want to look into have that information to reference, we will be sending out a recording. So if there was something like Tami just mentioned that might not be in her book, you can always revisit this recording of this webinar.
Yeah, everything I described in the slides is there, but for when I do PowerPoint presentations, I try to simplify the information. So that's why I just broke it down that way.
Okay. Do you know if the Stanford VA evaluation program is as comprehensive as you suggested one should be?
So my understanding of the VA is they're quite good and they're very comprehensive. At least that's what I've been told with the clients that work through the VA system.
Okay.
You may have to, and I'm just going to say this, and this doesn't matter, VA or anywhere, we have to advocate for our loved ones. We have to advocate for them and be very, sometimes we have to be pretty pushy and adamant that, can we do this? Can we do that? Right? And that's across anything medical. It doesn't matter if it's the VA, doesn't matter if it's Kaiser, Stanford, PAMF. We have to advocate for our loved ones. We're their eyes, we're their ears, and we have to do and say the things that we feel need to be done that's in the best interest of our loved ones, which is why that documentation is so incredibly valuable. Because many people, I'll give you a recent example. So I'm working with a daughter and a son-in-law. Anyway, long story short, the mother, we definitely know she's got cognitive impairment. I put money on it based on what they've described to me. She definitely has dementia. We finally convinced her to go see her doctor. And the doctor sits with her for 15 minutes. And he says to the daughter and son-in-law, I don't see any problem with your mother. She sounds very reasonable and normal to me. And so I don't think we need to pursue any cognitive impairment testing. All right, fast forward. So now I kind of lose my lid. And I said, we're not going back to that doctor. We're going to go to a neurologist or we're going to go somewhere else. Okay, now here's what you need to hear. 4 hours after that appointment, she goes to the bank. She thinks she's being robbed. She calls 911 and says there's a bank robbery going on. And she just left the doctor 4 hours ago. And you're telling me she doesn't show signs of cognitive impairment? So that documentation, you got the document, you got the data, you can't dispute the data. It's right there. So we do have to advocate for them. Yeah. I mean, I love telling that story because it's like, what? You know, we don't know why, but they can turn it on for a little while, right? Their social graces are something we're taught very, very, very young. That is stored way, 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 way back in our memory bank. So they can, you know, sometimes they can really step up to the plate, but it's not the norm and it's not going to stabilize. It's just really, it's something we see. And it frustrates the caregivers to no end that they can have this sort of rational conversation for 10, 15 minutes with Bob, and then all of a sudden fall apart. So when they go to the doctor's office, they might be able to answer the questions. They might be having a good day. The circuit board, everything might align up for that moment in time, but you can't dispute the documentation that proves otherwise.
Okay, I think this one might be revisiting the first one. I believe it's the same person. Just saying that they've read not all types of dementia are progressive, and they thought TBI can progress or not depending on the damage to the area of the
That's
brain.
exactly right. That's what I was saying.
Okay.
The doctor is going to know best based on the damage done to the brain.
Okay.
That's true. But if they have damage done to the brain and they get a diagnosis of dementia, dementia is progressive. If they've had damage done to the brain and they're not getting a diagnosis of dementia, depending on what damage has been done, that person is correct. But if we have traumatic brain injury and we get a diagnosis of dementia, dementia is progressive.
Okay.
That's the difference. We can have damage done to the brain and they don't have dementia. Then that's very true.
Okay. Let's see. What do you know of and think of available drugs to manage symptoms, such as side effects versus effectiveness?
So this is a very individual thing, right? So here's what I'm going to say. Anytime you notice behavior changes, anytime you change medication, you want to write down, or we introduce a new medication, you want to write down the date, you want to write down the time, you want to write down what the medication is and the dosage and the frequency. And we monitor the behaviors because there are a lot of side effects to medications. And here again, we see something sudden and it's the medication, we want to be able to note that and say, you know what, my loved one's having side effects from medication. A classic side effect of Aricept, that's a common medication that is prescribed for early on dementia to slow the progression, right? Well, diarrhea is a huge issue for some people with Aricept. So that would be a side effect. So it's really individual, because I can tell you this, medication can be incredibly beneficial, but it can be also incredibly difficult because of the side effects, and they can't be on the medication. So it's a really individual thing. And what I advise people to do is anytime there's behavior changes, medication, we document to see if we can keep track if they're having side effects of the medication, because it's very common.
Thank you. Maybe one more. Okay, my father refuses to admit that he's having issues. How can I get him to see his limitations?
So, like I mentioned earlier, if he has anosognosia, if there's damage to that, there's nothing in the world that's going to get him to see what you want him to see. So this is where documentation becomes super helpful and super handy. And instead of fighting and trying, I mean, it's exhausting trying to get them to prove a point to them. You don't want to do that. You're just going to alienate them. They're going to get angry. Spare yourself that. And instead document. And then it's, again, we present what we're observing, what we're noticing, and we present it to a doctor to show them this is what's happening. Yeah. But we don't, it's like pouring salt into a wound. I can't see what I can't see. You know what I'm saying? People who are worried will often, the people who are not in denial are really concerned that they're going to have dementia. My experience has been that people are going to say to me, Tami, I'm really worried I have dementia. I forgot this, or I'm doing this, or I'm doing that, right? And so if they cannot see their limitations, most likely there's going to be damage in that part of the brain. So we can't force them to see what they can't see. It really creates a lot of conflict between the relationship, and we just avoid that and find other ways now to work around it. Yeah. Okay.
I think that is all we have.
Okay.
Thank
All
you,
right.
Tami.
Yeah. Thank you everybody for attending today. And again, thank you for the love, the support, and the care that all of you provide day in and day out. And I hope this was a helpful, informative information for everybody.
Great. Thank you. Thanks, everyone.
Thank you, everybody.